mind, pardon the doctors, but pardon me, but it is the nurse who are the eyes and ears of the physician, and if you are not sensitive to the needs of the patient and are just concerned with what to do in terms of a task, then you will not be a very successful person. So basically, one has to have a genuine interest in nursing, in the helping profession. It's a science, so you should really know your theory, and you should be very well aware that you have a lot of knowledge, but unless you critically make decisions or critically analyze what's in front of you, then again, you could be wrong and it could impact patient care. So what are the qualities? Dedication. I would say also openness. You have to be a good communicator. You have to be sensitive. You have to be patient, very patient. Because sometimes with the load of the work, it could be both intellectually as well as physically. It could be very stressful. However, if you have a genuine interest, I think it helps also if you have a very strong emotional and spiritual side of your personality, because oftentimes when you're dealing with patients who are dying or relatives who are inconsolable because of some bad diagnosis, you draw on your strength inside. And so a nurse has to have very strong, I would say, spirituality as well, knowing yourself, how you would react, and then also being sensitive to how the patients or the family of the patients would react. That's very important, I think.
Now, if you were to add or perhaps change some of the subjects that you have taken in the past to suggest for the new curriculum of nursing, what would you say?
Really, because I'm from the older generation of nurses, the only thing I would say is that we should be more computer literate. But in those days, there were no computers, and some the sort of technical. But I think coming from, and I hate to brag, but the University of the Philippines is a very comprehensive nursing foundation. And I say this because when I had to write my board exam in Canada, I had 3 weeks to review, and I was really scared of failing because our graduates never fail. But I think I realized that the basic foundation of a nursing curriculum is key to a successful nurse as well. Of course, it's not just the school, but your curriculum. Right now, I can't really think, because even more so now, I appreciate how strong our foundation was in our university curriculum of the baccalaureate program of nursing at UP. So, I mean, I'm sure there are other very good schools, but the emphasis then was in not just accumulation of knowledge, but in critical thinking and in being able to, it's the higher forms of knowledge, not just knowing your facts and memorizing them, but being able to gather information, but being able to apply that information and critically come up with a nursing diagnosis or a decision that ties up everything. So the background of philosophy, because in arts and sciences we had philosophy, we had anthropology, sociology, psychology. You use all those knowledge, not just nursing, in dealing with the problems or the issues identified by patients.